Okay, round two. Here we go. More questions. This is a great question. Doctor stops effective Testogel treatment because my blood level's at 2.2 nanomole per liter. Why stop? So if you go into the balance, it's like balance hormones. I think it's Louise Newsom's. I don't know. I just Googled testosterone unit conversion because America uses deciliters, not nanograms per liter. So I had to convert that. So what you're saying is your testosterone's at like 62 American units. That's perfectly great. Women are super happy at that level. It's not too high. And I'm sorry your doctor stopped you for that. I wouldn't have. I would have said, yay, a happy woman on testosterone. Okay. Is DHEA the same as testosterone or different? Okay, DHEA is a precursor hormone, dihydroandrostenedione, and it converts into both testosterone and estrogen. It's an oral supplement in America. It's a prescription in other countries, and the studies are mixed as far as as far as oral goes. To women, I find that prescription hormone replacement therapy works a lot better. It's rare that I see a woman who's like, I just took a DHEA supplement and I'm super happy. Like, it's rare that that's enough to do much. So I tend to just go for estrogen, progesterone, testosterone, then mess with oral supplements. If you take an oral DHEA supplement and you're happy on it, great. It's probably safe. It's just that I don't think it's a legitimate treatment and it can't make up for using prescription grade. Here's a question. We all want prescription grade health skincare. Like, literally people advertise that, like prescription quality, prescription grade, blah, blah, blah. And like, people freak out about hormones. I'm like, it's prescription grade hormones. It's standardized. It's good stuff. Now, DHEA in the vagina, which in America is a prescription. It's called Intra-Rosa or Prasterone. It's expensive, but I love it. It is so good. It makes beautiful, beautiful vulvas and vaginas. So I hope that helped. It's not the same. Not the same as testosterone. All right. We're going to keep answering some questions. You guys sent in such amazing questions. Can you talk about high levels of estrone? Estrone is a less common estrogen in the body. 17 beta estradiol is the most common, which goes down after menopause. Estrone is probably, I don't have guidelines. I don't have the Menopause Society telling me this. This is my research. Probably the baddie in regards to inflammation. It's made by adipose tissue. We know too much adipose tissue is just a baddie anyways. We don't know what to do as far as measuring that and trying to get that down. I'm getting into the weeds here, and it's going to generate like more questions than I want to deal with from you guys. But I think you guys can handle the fact that we don't know a lot of this stuff. Most people won't check estrone. So what do I say? Be as healthy as you can. Make sure you don't have too much adipose tissue, because adipose tissue can make its own estrogen, and it makes estrone, and that might be the baddie in regards to breast cancer. But I'm not standing on a bunch of firm legs on this. It's kind of the fringy, more research needs to be done part of things. Will you please talk about the outcomes of consenting to unwanted sex? Sometimes a byproduct of scheduling sex, hoping for responsive desire, which fails. Fantastic question. Okay, I'm not sure we can really consent to unwanted sex. I'm not sure that's consent then, because part of consent is being willing to say yes, and then the part of consent is being able to unconsent at any time. It is the heteronormative world of sex is very linear. We start being intimate and it must end in orgasm and penetration, right? And think of that as just one theory of what sex is. So, and you got to break yourself from that habit, because literally Hollywood slams that paradigm down your throat. You are allowed to say, like, you know what? I am just not in the mood today. Erections are allowed to get soft. Vaginas are allowed to get dry. You're allowed to get a Charlie horse and a cramp. Like, you're allowed to stop having sex. That's called agency. Just because you start things doesn't mean it has to end in any certain way. So, I mean, most people are going to say never do unwanted sex. You can schedule sex. That's different than unwanted sex. If you schedule sex and it's unwanted, then you don't have to do it. Scheduling sex is really to set apart time for the experience of pleasure, for the experience of being close to somebody. It doesn't mean do things you don't want to do. And responsive desire doesn't always show up. And if responsive desire isn't showing up, give yourself an opportunity to like journal about that later or reflect on that. Was your mind too active? Are you stressed? Is your body in pain? Be curious as to why the responsive desire was something painful. Did you not have enough clitoral stimulation? Did you penetrate too quickly? Be curious why, because there will be an answer to that. And I think that is going to be part of your solution. Explain FSH, follicle stimulating hormone. It is produced in the brain, and it goes up in menopause because it's trying to get the ovaries to give some estrogen. And the ovaries don't give the estrogen, so the FSH stays up. I think there's amazing research being done on kind of the chicken and egg of all of this. Is menopause starting in the ovary because the ovary is declining, or does menopause start in the brain? And something in the brain triggers the ovary to stop producing hormones. We don't know. People who think they know don't know enough. How do you know when you're an expert? You know you're an expert when you know that we don't know a lot. Does all T just get converted to E and the benefit is felt because E ultimately goes up? Fantastic question. The answer is no. How do we know this? What if we did a study where we gave women testosterone and we blocked its conversion to estrogen? We've done that. So in breast cancer survivor patients. So they're on aromatase inhibitors, which block the conversion to estrogen. Hot flashes got better, moods got better, joint aches and pains got better, sleep got better. Estrogen remained undetectable. What does this mean? This means testosterone can help menopause symptoms. So no, if anybody says, I don't want to give you testosterone because it's just going to convert to estrogen, yeah, some of it will convert to estrogen, but that's not why testosterone's working. Testosterone's working because you have testosterone receptors everywhere, because you have a body that has testosterone receptors everywhere, because you have ovaries that make 4 times the amount of testosterone compared to the amount of estrogen that you make. Nobody knows this. Welcome to my world. All right. If you're having issues with the estrogen patch, which is better, estrogen gel or spray, see what your insurance covers. Go cheap first. HRT for people deemed high risk for stroke, higher than normal blood pressure. Do what you can to get your blood pressure down. Blood pressure kills people. Transdermal, pretty darn safe. See an expert who can calculate your cardiac risk factors. You need to optimize that. You guys, your health is not set in stone. You can do things to get healthier, not all the time. But I think so many people, like, you're just stuck with this like face tattoo of how your body is, and you have no idea the power to modify that with your mindset, with your exercise, with your diet, with your sleep, with your stress. So to me, I'm like, optimize this stuff. Why are we sitting back just saying it is how it is? Like, get as healthy as you can. This is your only spaceship. Like, take care of your spaceship. 49 with PCOS. I feel like I'm a forgotten person because I'm still having periods. Help. Well, because you are a forgotten person. It's called perimenopause. Some people don't even think it exists. Many people suffer profoundly in perimenopause and need help. See an expert, see a hormone specialist who's not afraid of PCOS. See what your symptoms are, see how we can help you with progesterone, see how we can help you with some estrogen, see how we can help you with some non-hormonal things. Is your insulin optimized? What's your fasting blood glucose? Are you exercising regularly? Are you sleeping? Right? So don't ever think that I'm like just into hormones. Like, hormones are amazing tools that I think are necessary for healthy body functions, but they don't exist in a bubble of otherwise neglecting your body. Why do so many health studies exclude women over 55? It's like we older women don't matter. It's because older women don't matter. Like, legitimately, the money is going to pregnancy, fertility, abnormal bleeding, all the things. So you need to tell them you matter. Get loud. Write your Congress people. Tell them you want more studies on older people. Tell them you want more studies on longevity. Tell them you want more studies on hormones. Get loud. You telling me, like, I can get a little bit loud for you, but like, get loud to the people who control the purse strings. Next time I'm going to ask you guys to just give me sex stuff, because it's like so hormones, but it's what you guys are interested in. Well, this is the best question. When are all the misogynists being replaced with real doctors that care about us? Love that. You guys, you may not know this. Medicine is a patriarchal craft. It was started by men. Women were excluded. Women have only been researched in regards to what their uterus does. We're literally trying to turn a big ship here. So, and here's my other theory. In the current health insurance-driven world, doctors don't have time to care about you. They have 10 minutes. They've got 20 people after you. They need to write a note. They need to answer all the phone calls. Oh, and also they're on call, so the ER is calling. I know this because I am one. So it's very hard to find somebody who cares in 10 minutes. How do you care about somebody in 10 minutes? You don't care about somebody in 10 minutes, right? So like, that's why getting somebody and like the doctor-patient relationship is precious. And that's why it's worth going in every year just to touch base, because that relationship is how you build caring. Let's see what else. Treatment options for SSRI-induced sexual dysfunction other than changing the antidepressant. You could change the antidepressant. You could try to wean off the antidepressant. You could try adding Wellbutrin or Buspar to the antidepressant, off-label, but there are some studies. You can try Viagra. Oral, women, yes. You can try testosterone. You can try flibanserin. You can try Valisi. What did I just give you? I just gave you like 5 different things you could try. So yeah, completely common. I saw one paper, it's like 80% of people on SSRIs have sexual dysfunction. Like, if they don't tell you that when they're like, hey, antidepressants work about as well as placebo for about 80% of people who are on them, plus they give you sexual dysfunction. Like, you should have informed consent. Oh, also, these things are really hard to get off of. So my hope is that people are going to, and anytime anybody says this, we've got to say, just like birth control is good, but it has side effects. SSRIs can be good, but they have side effects. Okay. Let's see what else. Let's see if we can do a little bit more here. What do you do if your sex hormone binding globulin is high? Do you bother with HRT? Sex hormone binding globulin is a protein made by the liver that binds, as it says, hormones. So it's just less free hormone to circulate and be active in the body. No, you can definitely be on hormones. It's just you might need more hormones to get the desired effect, because you kind of got to like push through the sex hormone binding globulin part to get enough that is going to be free hormones. You just might need higher doses. Is it better to go to your GP or OB-GYN to ask for hormones? Well, if either one of them says hormone specialist on their website, go to that one first. Being a certain type of doctor does not indicate knowledge in hormones. So I wouldn't say one versus the other on that one. Will using progesterone vaginally affect stress incontinence more than orally? No data on that. Is testosterone safe for those with slightly elevated liver enzymes? Stop drinking alcohol if you haven't already. Livers are precious. Transdermal. The limited data we have does not affect liver. But for me, I would just check your liver function tests a couple of weeks after starting testosterone and make sure you didn't bump anything up. But some people will say liver disease or cirrhosis is a contraindication to hormones. I don't think it's that black and white. Certainly liver failure is very different than slightly elevated liver enzymes. So I think everybody's going to be nuanced on that one. All right. Does vaginal estrogen help with queefs? Very good. It can. Queefing is just air trapped in the vagina. So if you have more moisture in there, you might have less like room for air trapping because everything's more like touching and moisturized. So it's possible. Give it a try. Not FDA approved for queefs, but nothing ever is going to be FDA approved for queefs. I'm no longer prescribed vaginal hormones now. I get systemic HRT. How do I convince her I need both? Tell her like 30 to 50% of people need to be on both. Systemic hormones for menopause is not a lot of hormones, you guys. Many people need vaginal hormones still because it's still so low dose. Tell her that. What are the side effects of too much testosterone? Acne, hair growth, hair loss, voice deepening, clitoral enlargement. You're going to start seeing that at male levels, which you can see with some high dose pellets. But with the transdermal gels and creams, it's very hard on a standard dose to push a woman into a male level with that. I'm 47 on my third Mirena IUD, no period, normal labs. How do I prove perimenopause to doctor? Proved by math. Average age of menopause is 51, so perimenopause is within 8 to 10 years. So by definition, 47 is perimenopause. There's no blood test for perimenopause, you guys. So you just are in perimenopause because you're 47. If you're having symptoms, treat you. Periods are irrelevant. Periods are irrelevant. Lots of people have IUDs and hysterectomies and ablations. They don't have any periods to tell them anything. And periods are not a marker of it's time to start hormones or not. Like anybody who doesn't know that isn't a hormone expert. What's your opinion on surgically induced menopause in mid-30s with no hormones? This is not my opinion. This is multiple studies. Young women who have surgically induced menopause, who aren't on hormones, die younger, have worse heart disease, have more dementia. It's not good. See somebody about hormone options. Like that's like pretty much as we're like, hey, do what you want in menopause with hormones. If you're young and surgically induced menopause, the experts say be on hormones until at least average age of menopause, because you have higher risk of death, heart disease, and dementia. We know that. What else do we got? We are wrapping up. You guys are doing good. I've got 3 more pages of questions. Let's see if there's a good. How can I get testosterone? No one will prescribe it to me. Bring in the testosterone guidelines, International Society for the Study of Women's Sexual Health. It's on my Linktree and Instagram. Print out the guidelines. It's free online. International guidelines for testosterone for low desire. Bring them in. Tell them you want to learn with you. Is testosterone pellet form safe for patients with hypercoagulable diseases? Yeah, I mean, I think transdermal is your safest, and I always like to jump to pellets after you're good on transdermal because I don't like 0 to 300 where you can get super high dose and it's irreversible. So I never say go 0 to testosterone pellet. I think we should go 0 to testosterone gel or cream and then a pellet if you're somebody who thrives at a higher dose and doesn't want the like daily application. So there's some nice plug and play with testosterone pellets. But yeah, from the data that we have, transdermal does not increase clot risk with testosterone. Thoughts on acupuncture therapy to help female sexual dysfunction? Yes. Won't hurt you. Might help you. Got some data. Helps with stress, helps with calming the body, helps with all of the things. So female sexual dysfunction is not one thing, you guys. It's multiple things. So you can't be like, oh, testosterone is going to help all of it. Acupuncture is going to help all of it. See an expert, but I don't think acupuncture is going to hurt you. Thoughts on perimenopause and birth control pills? Good idea or not so good? Do you need to prevent pregnancy? Because then it's a good idea. If you don't need to prevent pregnancy, you aren't partnered with somebody with sperm, or your partner who has sperm has a vasectomy, or you have had a hysterectomy, right? There's many reasons that you do not need to protect yourself from pregnancy. Then don't use the synthetic, high dose synthetic meds, which are birth control pills. Use the bioidentical, natural, low dose hormones, which are estradiol, progesterone, testosterone. Estradiol, progesterone, testosterone does not prevent pregnancy. So if you need to prevent yourself from getting pregnant, if you have sperm in your life, then birth control is what you need. IUD, then you can take all the other hormones. Where in your body is the best place for absorption of testosterone cream? I have not seen that study done. Most people do thighs because if you get hair growth, most people don't care because they shave. And if they don't shave, they don't care about hair growth anyways. So, all right. What else do we got? Who will prescribe me estrogen and testosterone as a HR positive breast cancer survivor? Hormone experts will. I would. Many people who are experts will. There are many people who are breast cancer survivors who are on hormones. We've got some data to support that. Multiple studies. There's always a risk of recurrence, but from what we can tell, hormones don't increase your risk of recurrence. So you just need to see somebody who's educated and knows what they're doing. What are my recommended lubes? I like silicone. I hate cold lubes. I hate sticky, tacky lubes. I hate basically that's like most water-based lubes. So get stuff without any coloring, flavoring, scent, or taste, unless you want some novelty. But I just think like less is better when it comes to added shit in your vulva. So silicone lubes, I love Uber Lube. They do make silicone water-based hybrids, which are kind of nice, best of both worlds. I'm to the point in my life where I just don't give a shit about silicone and silicone toys. Like, you do you. If you wreck your freaking silicone toy because you use too much silicone lube, you're using it a lot. Ask me how I know. I just like it. And I don't want to have multiple lubes for, am I going to use a toy or not? I don't want to deal with that. Keep it simple. All right, last page of questions. You guys are amazing. Could topical estrogen be helpful in alleviating peripheral neuropathy pain? Yeah, I think it's worth a try. There's multiple studies looking at the hormone modulation of pain receptors. There's multiple studies saying women's pain scores go down when they're on hormones. So can I go as far as being like, you're going to be cured from peripheral neuropathy? No. But do I think estrogen, also testosterone. Testosterone works quite well in decreasing pain. So, yeah, I think why not try it? So you guys, that is it. I've done a ton of Q&A. That's like 40 minutes. I love you so much. Follow me on Instagram for more. And if you like these Q&A sessions where it's just me rambling, let me know, because then I'll do more podcasts like this. So thank you much. Oh yeah, look, somebody said my pain dropped with HRT. Yeah. All right, guys. I love you. Until next time.